Well, the Solidarity Fund is asking South Africans to come together in its new campaign aimed at getting as many people in the country as possible to support the vaccine rollout program. So the campaign features stories of well-known as well as ordinary citizens who have responded creatively to encouraging new behaviours in the fight against coronavirus. This as the country is meant to commence with phase 2 of the vaccination rollout program starting Monday. The campaign went live earlier this week across a range of media platforms, including broadcast, digital and activations in rural areas and townships. Wendy Tlou is the executive head responsible for humanitarian response and behaviour change pillars at the Solidarity Fund. Wendy, it's so good to have you. Welcome.
Thanks for having me, Leanne.
So obviously the Come Together campaign is to try and encourage people to get vaccinated, create awareness, but perhaps you can tell us a little bit more about what it's all about.
Yes, it is about that. But I think significantly and more importantly, it's about reminding South Africans of, I think, the moments in our lives and the events in our lives where we've triumphed. And when we are at the time that we're at, where we've experienced 15 months of restrictions that have really impacted in how we engage with life as we understood it, we realized that we're at a state of fatigue, and we wanted to use this piece of work to remind South Africans of their resolve, of their ability to triumph, but also their ability to come together in terms of facing any adversities that we do as a country. And we did that through using well-known people, Dr. John Gunny, in the piece of work, but also ordinary South Africans and how we've adjusted through adhering to behaviours in order for us to mitigate against the spread of the virus. So essentially we're saying to South Africans through this, let's continue to adhere to the necessary behaviours. Let us continue to draw on that last resolve for us to continue this fight in order for us, to mitigate against the spread of the virus, but now, as we know, to potentially minimize the impact of an imminent third wave.
Yeah, and that's the big problem, because we are sitting on the cusp of this third wave, and there is immense COVID fatigue. I feel it. Everyone around me feels it. I'm sure you feel it, and that we just want to get back to normal, but we just can't. You know, this is the reality of our lives. How is this COVID fatigue affecting communities that you're going into and trying to educate as well?
It's affecting them in a number of ways, Leanne, but I think predominantly in that people are sort of not adhering to behaviours anymore. That sense of fatigue of, I've done enough, I can't continue to do this. And therefore that has the impact of us not continuing to wear our masks properly, or just completely forgetting about some of the protocols of the non-pharmaceutical interventions, such as social distancing, such as avoiding large indoor gatherings. So it's really starting to impact on how people respond to the behaviors and how they adhere to the behaviors. And it's become really, really important for us that outside of a mass vaccine rollout that is set to start next week, we haven't reached herd immunity. And in that case, it is really, really important for us. And I think drawing on the devastating impact of the second wave that we all went through over the festive season, it's important for us to really just continue with the work that we've been doing in terms of adhering to those behaviors, in terms of adhering to those behaviors even when we're with friends and family, and really saying to ourselves that it isn't just people that I don't know that I need to be safe around, but it's also even with friends and family, and we need to please continue with adhering to those behaviours.
Yeah, I think, this is something that we all need to do. I mean, we need a little bit of a wake-up call because, as you say, that fatigue it's real, and people have let their guards down and getting together in large numbers and trying to just enjoy life. But it is difficult, I must say. I mean, I even find it exceptionally difficult when you see how far along other countries are in the fight. I'm not talking to the likes of an India where we're seeing how they're battling and we do not want to go there. But you look at developed countries like the US and the UK and many other countries that have all basically almost resumed their lives. You know, concerts are going to start up, nightclubs are going to go back, mask wearing indoors is going to now not be necessary, and life has resumed and we're watching from afar, whereas the tsunami looks like it's heading towards us. So, you know, in terms of trying to get people to understand this, that it hasn't gone anywhere, you know, what is the core preventative behaviours that you're asking South Africans to do? Is it the usual, everything we've been taught, to just pick up these habits again, sanitize, mask, all of those things?
Yes, Leanne, it's essentially that. It's essentially, I think, continuing the habits and not just thinking that we can stop and start as and when we wish. The time is coming for us, we all hope, where we can live some semblance of life that is close to normality or what we were used to. But between now and then, it is really important for us to continue to wear our masks properly. And that means that we must cover our mouths and noses with our masks. Secondly, that we must continue to ventilate. So if we're in public transport or if we're in venues that where large congregations are, and with social distancing still, we must please continue to ventilate. And then to avoid large indoor gatherings, because we know how this virus is transmitted. And I think it's important for us to just always be adhering to these behaviors. So it's really the behaviors we know. We're saying that it's the last mile. The mass vaccine rollout program is set to start from next week. Our healthcare workers have gone through and are still going through this Sonke study and getting their vaccines. So it really is important for us that we draw on our strength, we draw on our resolve, we just keep getting motivated and inspired by pieces of work like what we've put out in order for us to just continue with the behaviors until such time that we've got significant vaccination and are reaching herd immunity, where I think life will be starting to look like what the developed world looks like.
Yeah, we can look forward to that. I mean, I know life will resume, but we do have a good couple of tough months ahead of us, unfortunately. Talk to me about the digital toolkit. I'm on your website. I'm having a look at it. So help me understand. What am I looking at?
So you're looking at the material of the campaign, and that's really about trying to get as many partners and stakeholders to use the material in their own brand platforms. And in particular, we're asking for business and civil society and government to use the material that we've produced, to co-brand that material that we've produced. It's free for their use, and to hopefully use it to inspire their audiences where they have an influence and large networks. And additionally, over the next week, we'll be adding in a lot more content to that digital toolkit, and that content will really be about spreading the message around these behaviors that you and I have been talking about, but importantly, starting to put in content that is about educating and building knowledge around vaccines. We found that there's quite a bit of, as you know, misinformation and ill information around vaccines. And we thought that our role, outside of calling people to register on the system, is really to empower people and empower South Africans with knowledge and information about vaccines so that they can make the right decisions for themselves based on credible information around what vaccines do, how vaccines work, how the COVID-19 vaccines were developed, and really what they stand to benefit from being part of a vaccinated nation. Yeah. So as we go into the week, we'll be adding in more content, and we'll also be starting to use some of that content when we go out to our activations around the rural areas in townships. And really that is, I think, a very live and real part of the campaign, where we'll be going and talking to ordinary South Africans, understanding what their challenges are, and also encouraging them to be knowledgeable about vaccines, but also to continue to adhere to the behaviours.
Yeah, and I'm glad that the material, as I'm reading, will be downloadable in all official languages. So that makes it, more understandable, because a lot of communities, all of the English paraphernalia and the messaging is just, not reaching everybody. So I'm glad that that's able to happen. Just one question, and I think quite important, because there was a little bit of a hiccup this week on social media and I know this does not pertain to you and to the organisation that you're in, the Solidarity Fund. But we're seeing that there are some of these influencers out there that are advocating for vaccines and, looking after yourselves, making sure, and getting vaccines. But they're not healthcare workers. They don't necessarily qualify, but, want to speak from experience as to what it's like to get a vaccine. I mean, are you doing that kind of thing or not really?
No, not really. So the way we've approached social media is really to leverage the platforms for what they're really good at. So in terms of partnership, and I don't want to call it influencing, in terms of partnership, we thought that the space to play in as a Solidarity Fund is really about educating people about vaccines. And educating people about vaccines is about providing the correct and credible information from the right sources. Ours is not to use our partners, whether they be in the business space or whether they be in the individual space, to be showing people of themselves getting vaccinated. So we're not playing in that space at all. We are rather focusing all our energies to say, how do we get to the communities on the ground with people who are relevant in manners and ways of engaging them that are meaningful to their context. But really, it's about driving the continuity of adhering to the behaviours and then educating and building knowledge amongst our communities about vaccines. We want to uplift and impact that percentage that I think we saw earlier in the week of about 71% of South Africans saying that they would take the vaccine. We want to impact in that space. We want to have more people having confidence in a vaccine and in a COVID-19 vaccine rather than showing people, getting vaccinated. And we believe that's the role of government, if it's part of their kind of strategy. But ours really is about saying, let us educate, let us build knowledge, let us create literacy around what these vaccines are, why they're beneficial to all of us, and how we then empower our communities to make the right decisions for themselves and to give them agency to say that I now have credible information, I now understand that credible information, and therefore I can make a decision that is correct and rightfully informed for me and my family.
Right. Thank you for talking to us. Good luck. Good luck with it. And I'm glad that we could chat to you about this campaign, trying to make South Africans aware, especially at this time where we really are struggling with this COVID fatigue. And we still asked to behave and make sure we can. Thanks. Thanks again for talking to us, Wendy. Wendy Tlou is the executive head responsible for humanitarian response and behavioural change pillars at the Solidarity Fund. All right, so we're going to take a look at a couple more